In this section, we're going to talk all about safety, information that you should know, how to identify overdose, the safest methods of consumption, things that you're doing that are potentially damaging your health rather than improving your health. But we're going to take a quick look now at the key information that you need to stay safe, protect yourself, your friends, family, and your community. So firstly, you need to be able to identify the signs of cannabis overdose and understand how to reduce the likelihood of an overdose and what to do in the event of an overdose. The majority of cannabis overdoses don't require hospitalization. The main issues that do require hospitalization are cases where someone does consume synthetic cannabinoids accidentally, or they mix cannabis with other drugs and have a particularly unsavory or unpleasant experience. Typically, what does trigger the need for hospitalization is the overconsumption of cannabis with alcohol and other drugs as well. Some of the symptoms of a cannabis overdose include drowsiness, you might have tremors, you might start shaking, you might get cold, you might be hyperreactive to stimuli, a little jumpy, a little on edge, and you'll probably end up having some abnormal eating procedures. You've heard of the munchies. That's typically what is a good sign of a cannabis overdose. Now, an overdose isn't necessarily dangerous or toxic, but there are cases where the overdose becomes so heavily overdosed that it can actually start to inhibit your function as a human and your health and well-being. In the event that that does happen, here's how you can manage some of the symptoms and manage the issue. Typically, the best thing to do is identify the source of the overdose. If it's a phytocannabinoid, you're pretty much going to be okay. Keep an eye on them and make sure people don't hurt themselves, stress themselves out. All you need to do is sit down with that person, calm them down, reassure them, make sure they're okay. The point of identifying the source of the overdose is to eliminate the potential risk that someone's accidentally consumed a synthetic cannabinoid, which is a lot more dangerous and a lot more harmful and has an increased likelihood of adverse effects. Now, if for some reason a child does get in possession of these substances and they do end up consuming a cannabis product or synthetic cannabinoid, they should be immediately taken to hospital. It's not worth taking any risks. Cannabis products, especially synthetic cannabinoids, have unknown effects on children and the child body, particularly people who are under the age of 16, as it impacts their health and mental health and well-being a lot more significantly than it does someone who's maybe in their 30s or 40s. Typically, a cannabis overdose resolves itself in 4 to 6 hours and there is no issue, there is no further action required other than sit down, stay calm, have some food, have some water, hydrate yourself and try and stay as calm as possible. Second main risk that can occur, and the main thing to avoid with cannabis products, is mixing cannabis with other drugs, particularly prescription medications. If you do end up mixing some of your cannabis with a prescription medication accidentally, you're potentially looking at quite a lot of harm to your body. It can have long-lasting issues on your body if this is something that's occurring frequently and you're accidentally causing toxicity in your body by inadvertently mixing cannabis with your blood thinners or with your epilepsy medications. That combination effect of those drugs, and when those drugs combine, has untold effects on the body. So make sure if you are on prescription medication, you speak to a doctor first. So if you look on drugs.com, you can see specifically all of the medications that cannabis interacts with and what the potential damages are, what the risks are potentially, and the interactions that might come about from mixing cannabis with your prescription medication. So if you've been doing that already for a long time, stop immediately, have a look, speak to your doctor, make sure you know what's going on and make sure that you are not causing yourself injury by accident and potentially damage your health in the long term and short term as well, acutely. Third risk to be aware of is the contamination of your cannabis products. Now, we talked earlier on in section 1 about just how complex cannabis products are, the number of elements that are in those. When you are consuming a product, you need to understand that there's a lot more in there than you're likely aware of. So a number of studies have looked at and analysed the products that are available on the market across America, across Europe, and what's often found is that the majority of those samples that are tested contain some sort of contamination. Now, that can be everything from residual solvents that are found in the extraction process and used to extract the oils from the cannabis plant through to pesticides that are used to keep obviously germs and fungus and bacteria and pests off of the cannabis as well. And another study conducted by the FDA in 2020 looked at the claimed content of the product versus the actual content of the product, and they found that 18% contained less than 80% of what was claimed on the product, 45% contained within about 20% of what was actually labeled on the product, 37% contained more than 120%, so that was more than what the label said, and 49% of the products contained THC when there's meant to be zero THC in CBD products. So you can see again why the police are so stringent when it comes to assessing cannabis products for their legality and for their contents. Make sure that you are incredibly knowledgeable on the product you're consuming, and if there is accidentally THC in your CBD product and you're getting drug tested at work, you're potentially losing your livelihood, you're potentially getting fired. These are really important factors to be aware of, and these are things that the CBD industry isn't telling you about, these are things that the cannabis companies aren't telling you about, and these are also issues that the government and regulatory agencies aren't telling you about either. Another massive way that you can improve your health is through cutting out the smoking of your cannabis. So because of the high combustion temperatures that come about from smoking in any form, whether that be a bong or a joint, only 12% to 30% of the cannabis that you're using is actually absorbed and utilized by the body. The rest is destroyed. The majority of the constituents that you're inhaling are toxic elements, carcinogens. All you're doing is damaging your health by smoking. There are very few benefits to smoking, if any. So by using a vaporizer, you're absorbing 90% of those cannabinoids rather than destroying up to 90% of those cannabinoids. So you're avoiding all of the carcinogens, the stuff that causes cancer. Herbal vaporizers are a far safer way of consuming cannabis. If even though you are consuming cannabis safely, then with a vaporizer, you still need to be aware that molds might be present within the cannabis, there might be heavy metals within there, pesticides and other solvents, and this is going to help you reduce the harm associated with your cannabis consumption. It's going to improve your health and make sure that you are being as safe and as healthy as possible, even if you are going to consume these drugs. So again, I'm going to criticize joint smoking some more. In every joint, you've got tobacco and cannabis, and then also the chemicals within the papers. Tobacco smoke is a mixture of more than 5,000 different chemicals. Smokers who do mix tobacco with their cannabis have an increased dependency, they have more psychosocial problems, and it's more difficult for them to quit smoking as well. Rolling papers are also just as bad. They're bleached, they're filled with other toxic chemicals as well to keep the paper white, and also addictive chemicals to make you smoke more. There's 33 different chemicals in rolling papers which you might not be aware of. It's these fast burning bleached and flavored papers that contain the most toxic elements. All of this has long lasting effects on your health. It's damaging your reproductive system, it's damaging your organs, and it's also increasing the likelihood of you developing cancer and other health conditions as well. Another one to look out for is e-liquids. So yes, you can now access e-liquids that contain CBD, but what's interesting is that 23% of e-liquids are contaminated with some sort of microbial toxin, so mold or some bacteria that aren't meant to be there. 40% of people who do end up using these e-cigarettes and e-liquids on a daily basis report a number of different side effects. Now, those side effects can include lung disease, oral cancers, lung cancers, head and neck cancers as well, and it has a lot of adverse effects on your reproductive system. So it's going to damage your sperm, it's going to damage your ovulation and your eggs and your ability to have a period and have a baby. There's a lot of adverse reactions that come as a result of consuming these products. So another issue I want to talk to you about is the consumption of cannabis by pregnant women as well, and the maternal consumption of cannabis, which does very clearly seem to affect the maturation of the brain in children. Cannabinoids can cross from your body through your placenta and into the baby as well. It affects the development of the placenta as well and the overall development of the baby. Once the baby's born, cannabinoids can accumulate in breast milk. This is why they recommend that pregnant women do not consume cannabis, just because everything that you consume pretty much ends up in your baby and affects the development of your baby. There's a wide range of physiological issues that arise and also neurodevelopmental issues that arise as well. So These include a low birth weight when the baby's born, impairment when it comes to your cognition and brain function, psychiatric diseases too. It could potentially damage the long-term mental health of your child. Looking at potentially psychosis, depression, and anxiety as well, because those cannabinoids are affecting the brain's neurocircuitry. It's affecting the cells of the brain. It's not until later in life that these issues actually develop and start to present themselves as there's a lot of long-lasting effects that come from that maternal consumption of cannabis. And so we really want to make sure that mothers are aware of how cannabis is affecting their health and the health of their baby. To conclude and help summarize a few of the points that we've discussed in this training, yes, your body produces cannabinoids. Cannabis on its own is very safe. If you are going to consume cannabis, take a quarter of the dose that you would take and don't redose for at least an hour. Give your body time to absorb those compounds. Everyone's body absorbs at different rates, and so be patient. Don't accidentally double dose and then end up overdosing yourself. And our current drug laws in the UK are nearly 50 years old, so they're long overdue an update. And all of this science here will be soon incorporated into our drug policies and into our cannabis policies as well. Final point. So the best way that we can start protecting ourselves, our families, our friends, and our communities is through harm reduction and educating people and making them aware of these factors and of these facts and of this science. Make sure to share this with friends, take as many notes as you can, and make sure that they're all thoroughly protected and informed and making smart decisions. Before consuming cannabis, before thinking about cannabinoids and using those to improve your health, there's 4 things that you can do to improve your health without actually having to delve into the world of cannabis and start making all of these cannabis decisions. And number 1, your lifestyle. Improve your activity. Make sure that you're not sedentary. Make sure that you're getting out there, moving your body, looking after your body. Then you need to make sure that your diet's right. Make sure you're fueling your body with the right elements that your body needs in order to be able to function properly. You want to be improving your diet before introducing any external substances or any drugs for that matter as well. Sleep is another massive element that helps your body operate more effectively. A lot of people are undersleeping and not getting enough sleep on a night, and so their body isn't recovering properly. Finally, alcohol and other drugs. Alcohol is probably one of the biggest damaging substances that exist at the moment. It's readily accessible. There's a massive culture of alcohol consumption and other drug consumption. All of this is impacting your health, disturbing your endocannabinoid systems, disturbing your internal physiological processes, how your body works, how your cells react, how they respond. And so there's a lot of things that we can do as individuals. There's a lot of responsibility that we can take that doesn't require consuming cannabis and experimenting with cannabinoid products. The good news is, if you do have questions, you do have problems, and you want more information, the GCS team is on hand. We'll soon have an additional wave of tools to support you with your safe decision making, reducing harm, helping you solve community level issues. So if you've got an organization that needs help, we're here. We can create anything to help you fill those gaps, empower your communities, and protect everyone involved. So to keep you safe and informed, we have a whole host of different tools at CannabisScienceTraining.com that you can use to stay ahead of the game. We've got books and guides. So we've got a book on Amazon which is available, the Canna Manual. That is everything you need to know about cannabis as a consumer, how it works, where the law's up to. Goes into more detail than we can here in this short training. We've got a whole host of other guides, books, tools, events, and opportunities as well to get involved in the cannabis industry and some more of these debates and conversations that are taking place across the country. If you are thinking about joining in the cannabis business, getting yourself involved in the cannabis industry, we have a whole host of additional trainings that go into a lot more detail at a professional level and at a corporate level to reduce your risk of failure, save you time and money, and help you make innovative and informed decisions. So as a thank you for completing this training, if you are a business or someone that wants to become more informed and get into the cannabis business, you can use the code GCS20 and you'll get 20% off our professional training programs. And you can join our business community as well and benefit from all of the wonderful scientific knowledge and expertise that are there to take away the guesswork from you and give you a stepping stone into the industry, into the business, and into safely navigating this sector. So I want to say a big thank you for taking the time to go through this training. If you've got any additional questions or you want to look for more information, our website is filled with additional links to our social media where we've got more free content. We really appreciate you taking the time to help us share this information and connect it with those who need it. A big thank you from myself and Global Cannabinoid Solutions. Stay safe, stay smart, stay scientific, and we will see you all very soon. Thank you very much.